Chronic back pain can feel like an endless battle. Maybe you've heard about spinal steroid injections as a quick fix. Does that mean you're set for permanent relief? Today, let's uncover what these injections really do, why the latest research questions their long term effectiveness, and what alternatives may give you better lasting relief. Steroid injections took off because they target inflammation right at the source. For years, many doctors considered these to be a near miracle for sciatic pain as well as other stubborn back issues. Usage skyrocketed, especially when patients wanted fast relief, and healthcare models made these procedures easy to approve. Picture inflammation in your spine as a small fire. Steroids act like firefighters, dousing the flames to cool off your irritated nerves. The pain often eases quickly, which feels amazing in the moment. But if the building's wiring, i.e., your spine's structure, remains faulty, the fire can reignite. Hence, repeated injections may become standard, yet never address the root cause of your pain. What got me interested in this topic was a recent comprehensive guideline that was released by the British Medical Journal. They basically pulled together findings from over 100 clinical trials. They looked at these different interventional procedures, including epidural spinal steroid injections, and they asked, do these actually beat placebo in the long run? The answer, unfortunately, was no. So the key takeaways from the data. First, the short-term relief is real. Many patients do report lower back pain in the first few weeks after an injection. So that's what drives their popularity, because quick results can be very appealing. However, the long-term gains are minimal. Once you stretch this out to a few months or beyond, the research shows that repeated steroid shots don't consistently outperform sham injections. Essentially, the results taper off, especially if the underlying mechanical or lifestyle factors aren't addressed. Additionally, there's a risk-benefit trade-off. These studies noted that the injections do come with a small but very real risk of things like infection, spinal headaches, and other complications. So if you're not getting sustained relief, those risks become much harder to justify. One reason for these disappointing findings may be that chronic back pain, and that's defined as pain lasting more than 3 months, often involves multiple factors. This can include things like disc degeneration or muscle imbalances, or even psychosocial stress. So steroids alone can't fix these deeper issues. Instead, injections might temporarily quiet inflammation without truly halting the cycle of pain. So while a one-time shot may get you through an acute flare-up, repeating them for indefinite pain control usually isn't the best plan. Think of it this way. If an injection acts like a bandage, you never really clean or stitch around the wound. You keep needing fresh bandages, and this isn't truly healing. So what are the risks you need to know about? The first one, while rare, is infection. And this is particularly serious because it's affecting your spinal area. The next one is because it's a dural puncture, it can result in a severe, what we call a spinal headache, which could require further treatment. And lastly, it can cause nerve damage. And again, this is extremely uncommon, but it could be life-altering if it happens. So while the benefits are primarily short-term, these risks become harder to justify, especially for chronic pain that's been lingering for months or years. So who may benefit? In some cases, 1 or 2 injections may make sense. First, for like a severe sciatic flare, if you're in massive pain, a quick steroid shot can cut that swelling enough to let you function. Also, for diagnostic clarity, sometimes an injection may help pinpoint the nerve root that's involved. And lastly, as a way of delaying surgery, doctors may try using injections if they feel like they can stave off a bigger operation. But beware of the hamster wheel of repeated injections. It often means that you're just masking the pain, not truly resolving the underlying cause. So going beyond the needle, what are some alternative strategies? First is physical therapy and building of strength. So correcting posture and building core strength can really help to address the core mechanical stresses that are causing the pain. Additionally, lifestyle shifts. So adjusting your diet, your sleep, and stress can reduce overall chronic, systemic inflammation that's fueling the back pain. And lastly, mind-body approaches. So techniques like cognitive functional therapy can help rewire how your brain perceives this persistent pain. These might take more time than an injection, but they help to tackle the deeper cause of the pain as opposed to just offering a quick fix. So the bottom line is that while repeated steroid injections may offer some short-term relief, the current research really shows little long-term benefit, and every shot comes with risks. So if you're in severe acute back pain, a well-timed injection could help you function. But if you find yourself going back every few months, you need to pause and ask yourself, are we solving the real issue or are we just putting out these small fires? In terms of key takeaways, first thing, explore alternatives, physical therapy, structured exercise, or addressing underlying metabolic factors. Additionally, you need to weigh the risks versus the gains. An injection may help short term, but it rarely fixes why your back actually hurts. And lastly, stay informed. Talk to your provider about core strengthening, diet changes, or mind body therapy. I'm Dr. Carr. I'm here to help you make smarter choices to live a healthier life. If you found this video helpful, please hit like and subscribe or share it with someone else you think could benefit from the video. Thank you.